Hi, my name is Dr. Landon Pryor, and I'm a board-certified plastic surgeon. And on this channel, we discuss luxury self-care practices of all forms. Welcome to today's conversation about Restylane Lyft. Be sure to subscribe below and leave a comment with any questions you have about dermal fillers. So one of the really popular treatments right now that patients are coming in and asking about is Restylane Lyft. That's a great treatment for patients that have facial aging or are looking for a little bit more definition in their cheeks, jaw lines, other areas where potentially some additional volume or contouring could be beneficial for a more youthful or rejuvenated look. Restylane Lyft has a higher viscosity than some of the other hyaluronic acid-based products. It's designed to add volume and shape to areas where patients don't have it, either because of genetics or because of the aging process. Part of the aging process is related to volume loss in certain areas and fat pockets. As we get older, they undergo a process called atrophy, which causes them to shrink down. So the goal is to add volume where patients previously had it, but it can also be used in other areas to help restore volume and shape as well. There are things that can be done both during the injection process and afterwards that minimize risk for discomfort. Again, depending on where you're getting treated, your provider might be able to apply topical local anesthetic to the areas of the injection site, which are going to minimize with needle sensitivity. Depending again on areas that are treated, sometimes nerve blocks are used. There's several larger nerve clusters in the face that can be anesthetized with local anesthesia. Obviously, ice packs during and after the procedure are good to minimize both sensitivity and pain during the procedure, as well as bruising and swelling afterwards. It's usually pretty unusual to have a patient need any kind of actual narcotic pain medication following a treatment. Usually, if there is any lasting discomfort following the treatment, that can be managed with over-the-counter medications like Tylenol. Restylane Lyft is a hyaluronic-based filler, which means that it's going to last probably about 12 months, which is great for some patients that are just looking for short-term correction. Maybe they don't want to commit to a longer-lasting filler because they've never done it before. They want to see what it's going to look like, make sure they're happy with the results before they commit to something that's going to be more durable. There are longer-lasting fillers like Sculptra, which is essentially the same material that's in resorbable suture. That's been shown to last for 2.5 years following treatment. So for somebody that's looking for more of a durable result, but maybe not something permanent, Sculptra is a great treatment for volume augmentation. There's another filler on the market that we use a lot of called Bellafill, FDA indicated for nasolabial folds and acne scar correction, but it's great because it's been shown to be safe and effective for 5 years following treatment. So again, a great filler for somebody that wants something a little bit more durable, as long as they're comfortable with what those effects are going to look like. Sometimes it's done as a second stage after initially performing some contour correction and volume augmentation with a short-acting filler to make sure that patients are comfortable with that type of appearance following their initial treatment. So again, there's lots of different options. It really depends on what the patient's expectations are for improvement and what they're able to set aside for cost and downtime and recovery. So it's really interesting as it relates to fillers because they all work different. They all have different mechanisms of action, and so that all has to be discussed and expectations have to be set. With regards to like Restylane Lyft, for example, because that is a hyaluronic acid-based product, you're going to see the results right away. Right in the chair, looking in the mirror, you'll see the results. You'll leave, you'll be happy. Usually pretty minimal swelling associated with that. So what you see is what you get. And just gradually over time, over that 12-month period that we talked about, that's going to gradually break down and absorb, and you may need to come back and get additional treatments to maintain the results. Some of these other products that we've talked about, like Sculptra, that actually takes more time to see the effect. So you'll see some initial benefit because a large part of the initial effect is the saline that it's actually mixed in. But then as that absorbs over the initial 72 hours after injection, it leaves behind these little beads that we talked about of the polyl-lactate acid, which then causes your body to build collagen. Because it does require your body to do that, it takes typically anywhere from 3 to 6 months to see the results following the initial treatment. So that's something that you'll want to plan ahead as far as getting treated. Bellafill works a very similar way. Bellafill itself is actually a combination of this microsphere of PMMA and bovine collagen. When it's given to patients initially, the bovine collagen is what gives them their initial results. So you get the immediate benefit of the bovine collagen as a filler, but that does not last typically longer than about 3 months. And so over that time period, the bovine collagen is dissipating or breaking down. You do see the benefit of the filler, but then as that collagen breaks down, your body is building up the collagen around these microspheres that are left behind. So typically, again, same with Sculptra, you don't see the total effect of the injection until at least 6 months after the initial treatment. And then that can continue to get better up to 5 years from the treatment. So it's definitely a more long-lasting filler. So with a hyaluronic acid filler like Restylane Lyft, do's and don'ts prior to treatment. Generally speaking, it's a very safe and effective filler. One other thing to kind of mention as it relates to all of the hyaluronic acid fillers is it's very reversible. So there's a product called hyaluronidase. It's actually an enzyme that can be used to break down or dissolve the filler if for whatever reason you don't like it. So less of a commitment there, because if you do get a filler with Restylane Lyft or another HA-based filler and you don't like it, your provider can just reverse it and kind of go back to baseline. Things to kind of be mindful of prior to treatment would be, obviously, anytime somebody sticks a needle in your face, there's risk for bruising. Avoid alcohol for 3 weeks. That's going to be in patient's best interest. Other medications that also contribute to thinning of the blood, ibuprofen, Aleve, Motrin, Advil, Excedrin. And then there's a lot of herbal supplements also that have to be considered prior to getting treated. Vitamin E, fish oil, multivitamin. So those are just conversations that ideally you want to have prior to getting treated to make sure that you can get the best results possible. If you enjoyed this video, leave a like below. We would love to hear your questions about Restylane Lyft or any of our other dermal filler products. And please subscribe below to stay tuned for next week's show. See you next week.